Hi, my name is Dr. Simon Agger, chiropractor and clinical nutritionist, and we're talking about upper cross syndrome. This is something that happens, it's a very common postural compensation, and I want you to understand, just like the lower cross syndrome that you may have already watched on our videos or on our YouTube, what happens to get us into this situation. A lot of times we get chronically shortened muscles because of our posture, our sedentary lifestyle, and they don't always get stretched. We get busy, we stop moving around, we start to do things for hours at a time that are repetitive every day, and we don't always get to balance those. So it's important to know what happens to the body, and then we're talking about specifically the head and neck and upper back, mid-back region, common things that happen. And in the upper cross syndrome, one of the things that happens is we get a lot of tightness in these upper trapezius muscles through here, which come off the shoulder blade and come up into the spine through here and into the back of the head. And these guys get tight. Other muscles that get tight are on the front, in the pectoral region through here in the chest, and they come through this way. And these guys get tight too. So we have a situation where we get tight up through here, we get tight here, and as a result, we get weak in these deep muscles through here. These guys get weak. And between the shoulder blades, the shoulder stabilizers through here also get weak. Hence the upper cross syndrome. Tightness, weakness. So what does this mean? When we get connective tissue, that's the muscles, the ligaments, the joint capsules, and the cartilage, when they shorten like that, it sends a message to the brain saying, hey, we're shortened, we don't lengthen anymore. And as that happens over time and continues to happen, the brain gets used to that state of affairs, so it accommodates. Accommodation means your body will accommodate to whatever you do to survive and to try and work with it. So when we get tight muscles like this, one of the things that the brain does is it adapts and says, okay, you're tight. So a lot of times we get different changes in our posture. The head a lot of times will extend and we'll get tightened at the back of the base of the neck. If you ever put your finger at the base of your neck and you feel tightness there, it's because this area is shortened and extended. And these tight muscles extend up through into the back of the head. This also means that we lose some flexibility through here too. And because the nervous system is compensating for all this, everything that we do from the ground up, it'll try and keep the eyes on a level horizon. So when one of these muscles here gets tight, what will happen is it'll pull the head slightly this way. The opposite side will fire to compensate, and then both muscles are tight. And we see this all the time, it's very common. Tight upper trapezius. These muscles become weak as a result of that too, and therefore when we lift the arm up, the shoulder blade right here, which should be strong and a strong base and foundation for us to do all this movement up through here, it loses its ability to stabilize. That's why you guys are getting rowing exercises, V-rows, and exercises that fire these muscles down through here. And we're shrugging to try and fatigue these muscles while we're working on other things, and we're doing the appropriate things to fix this so it doesn't stay like this with poor posture. When these guys become weak, the scapula, that's the shoulder blade, tends to wing, and it'll wing out this way to the side instead of staying stable, and we'll get a lot more stress on the shoulder. So when this situation happens for a long period of time, the shoulders slowly start to internally rotate through here, and we get pinching right here, bursitis, chronic shoulder pain, tightening of all the nerves that come out of the spine and go down and working the hand, and maybe we'll get some tingling and numbness too. So when we're working this, one of the things that's happening is we're getting compensations that's altering our function and how we work. And the chronic shortening is a result of posture, sedentary activities, and also pain. If we get pain, the same thing happens. The muscles can tighten in response to pain to try and protect themselves. And if the pain goes on long enough, we can also get shortening and get into some of these upper cross syndromes too. So it doesn't necessarily have to be chronic postures or sedentary postures, pain can do it too. And like I said, it affects the motor patterning, how your central nervous system integrates with the body, how the body speaks to the central nervous system, and how it delegates tasks as a result of that. How do we fix it? The adjustment is one of the most powerful things on changing the central nervous system, affecting the brain and switching some of these tight muscles off, getting some of these joints to move. Because as you can appreciate, what happens when we have tight muscles like this, these joints get compressed. And we get a lot of compression at the base of the spine, and we get a lot of compression at the base of the skull. Compression at the base of the skull can lead to headaches, dizziness, unbalancing, and pain syndromes through here. Disorders down through here can lead to disc degeneration, numbness and tingling, and chronic pain in the shoulders. So as we adjust that, and basically, as you know, an adjustment is just restoring motion to a joint through here, we switch these tight muscles off and allow ourselves to work on some of these weak muscles through here. So in a nutshell, after we adjust, we start to lengthen and strengthen the appropriate weak muscles, and the tightness through here diminishes, and over time the upper cross syndrome is addressed, nullified, or not made to get any worse. So there you have it, upper cross syndrome, what it is, how it happens, what can affect it, and how to fix it with adjustments, lengthening, stretching, and strengthening. Again, my name is Dr. Simon Agger, and now you know about upper cross syndrome.